Hello everyone, this is Saima at Holistic Happiness Academy, and today's topic is about chronic pain. Why does chronic pain make life as difficult as it does? And why is it that medication does not always help? And what can we do with meditative, hypnotic, or somatic experiencing techniques to help with chronic pain? So, if you or someone you know suffers from chronic pain, then this is the video for you. Please post in the comments below what you think about it. Subscribe to my channel to get information from a real person who actually has a real practice. And my insights are available for you to feel better, learn, and grow. So, the first thing about pain is that it takes over your attention. It completely sucks a person's attention like, a black hole. And pretty soon, we just get so focused on the pain that we can't think of anything else. And this is why we want to be very mindful and start to expand our awareness, because otherwise, our life can become quite shrunken and limited to just the pain that we're experiencing. So, one of the things that I've noticed with a lot of people who have chronic pain is that they may be taking many medications, pain medications. However, their pain, their experience of pain, never quite goes to zero, even with very deep, heavy pain medications. It can come down to maybe 2 or 1 or 3, but never quite zero. However, with hypnotic approaches, um, those chronic pain sufferers can reach the zero level and may even be able to maintain it for a while before the pain comes back. And with those kinds of approaches, the pain it may not be as limiting, because there is a psychological freedom in those approaches that a person develops. So, when I speak of physical chronic pain, I also want to actually touch a little bit on emotional chronic pain. There is such a thing, because we can have a trauma, something we're very affected by in our life that has a familiar emotional pain to it. And just like physical pain, emotional pain can also be remembered by the body, and it can be very hard to move beyond that. And I don't want to really label emotional pain necessarily as depression or depressive personalities or anything like that. I want to make sure that we're talking about the specific issue rather than, getting lost in labels or analysis. So, we can do a few things when it comes to chronic pain. We can soothe and calm down the nervous system. The nervous system has two major parts. One is the autonomic nervous system, which is the parasympathetic, which has the parasympathetic nervous system. And there is the sympathetic nervous system and parasympathetic nervous system within that. Sympathetic nervous system is what triggers our fight or flight response, which means that when we feel pain, we may have a fight response. We may start to become aggressive. Our body language or our non-verbal body language can become aggressive or outer directed. We can be irritable. Sometimes when people have pain, they can be irritable, they can be annoyed, they can be angry and frustrated with the pain. So those are signs that the sympathetic nervous system is engaged. The other thing that can happen is that our freeze response kicks in, especially if it's very painful to make a movement when we are in pain. Movement increases the pain, then some people may develop a very strong freeze response, which means that their body becomes really tight, and their muscle tension around the shoulders, neck, hands, back, legs can create a sensation of pain throughout the body. So that is, those are all trauma responses, and the trauma can come from the pain itself, from having the pain, as well as the actual issue, injury, operation, that has created the state of chronic pain. Now let's practice a few simple techniques. Number one, getting into the sensory system. So experiencing the senses instead of staying very focused on the pain. How we do this? We make sure that we're breathing. So let's do that together. Let's inhale deep, slow breath through the body. And a big exhale out. Now you can vocalize. You can stick your tongue out. You can go ha, or you can stick your tongue out generally to relax the muscles of the jaw, because many times we just start to tense up the body and it's very subconscious. So big 3 breaths. Inhale your second breath through the nose. It doesn't matter where the pain is in your body. What matters is the way you're observing the pain, and that's what we're going to practice today. Big inhale and exhale for the 3rd time. Whew. And start to kind of look around in your environment. Notice what's there in your environment. What are the colors? What is attracting your eyes? Just put that question forward. What can you observe about this environment? What are the shapes that are attracting you? Just asking your question and engaging your mind with something in your environment. Okay. Now tune in to what is happening inside the body. What can you feel inside your body? You may feel the pain. You may feel some other things also happening in your body. These are your body sensations. Breathing in and out, notice one most uncomfortable sensation. And exhale. Now drift your awareness again to the world outside you. This time listening for sounds. What kind of sounds can you hear? Inhale and exhale. Really bringing your attention to your ears. Noticing the sounds maybe in the body as well. Maybe your heartbeat. Maybe there's a sound of tinnitus sometimes. Sound in the ear. A rumbling sound in the tummy. Just becoming aware of the sounds in the body and also becoming aware of the sounds in your environment. Practicing non-resistance. Observe and let it go, just like watching a sky with clouds. Just like you watch the clouds drifting on that sky, the same way watching the sounds drift across. Now expand your awareness into the physical sensation of your skin. Notice any part of this body where you can feel your skin. Maybe your right cheek. Feeling that skin from inside your body. What's the sensation like in your right cheek? Breathe in it through the nose and down, all the way down to your toes. And notice perhaps the left cheek, the sensation of the left cheek. Inhale and exhale, and as you exhale, you may find that little shift happens in your environment, in your experience. Notice the level of discomfort on a scale of 0 to 10 right now. Where is the discomfort? Where 10 means extremely uncomfortable and 0 means completely comfortable. Somewhere, just pick a number. That's fine. Allow your eyes to keep drifting, drifting to the shapes in the room, drifting to the colors. And we want to practice not judging what you see. Try to bring yourself back into the sensory experience again and again. Instead of thinking about what you're seeing, instead of judging it, instead of reacting with a thought, just observe what it feels like to look at it. What's the sensation in your eyes when you look at the world around you? Now imagine letting your vision drift further away into the distant. Maybe in front of you, you can see nature, trees, flowers, maybe it's paintings, maybe it's the door opening to another part of the room. Let yourself notice what is distant and then bring it back to what is immediately in front of you. The distance back to what is immediately present. And let your eyes decide what you're attracted to and let the eyes savor that sight. Now tuning in back into the body, noticing anything that's piquing your attention. Something that is there that attracts your attention. What if attention was like a small bird looking around at the world around it? And that's how I'd like you to practice. Just observing everything, skimming over everything, noticing it as a sensory experience rather than as a cerebral experience or something for you to analyze, infer, or build a story around. And sometimes when there is pain, we build a story around it. I shouldn't have done this, or I should have done that can be a story. Why didn't I do that? Or thoughts of it's always going to be like this, it's never going to get better. So, whatever story you tell yourself about the pain, this is an opportunity to sort of let that go for now. Just like clouds, analysis, thinking, just call it labeling. Just label it thinking or story and watch it drift across like a cloud on a summer blue sky. Without engaging with it, it's there and let it drift. Every time we relax our nervous system, we actually may be able to sensitize the pain and reduce its intensity. And our mind-body connection can give us some relief and some healing. Now tuning into the physical body sensation, feeling, observing and noticing what it feels like, what's the sensation in your shoulders. Breathing in, breathing out. And gentle inhale, notice the sensation in the upper right arm. Breathe in, breathe out. Notice the sensation on the skin of the upper left arm. Breathe in, breathe out. And you may start to feel like your attention is just expanding energetically as well, sort of soothing, moving. Breathing in, breathing out, feeling the sensation in the elbow, the right elbow this time, and feeling the sensation in the lower forearm. Feel the sensation in the left arm, noticing and observing if it expands or rests somewhere. Letting your gaze, your inner eye, wander through the body. Where does it want to settle? What else is it aware of in this moment? There's so many things that we're aware of outside of what we are thinking about. And this is an opportunity to develop and expand that awareness, which is deeply soothing and calming for the autonomic nervous system. Notice a part of your body that is calling out for your attention and breathe into it. Breathe out. What if it could be safe to feel this feeling? Perhaps it's an unsafe feeling. What if it could be safe to feel this unsafe feeling? And what if we could say it's safe to feel this unsafe sensation or unsafe feeling and safe to let it go? Working with the breath. When we settle into the breath, we find a very calm place. Underneath all the other things that we're aware of in our life, we are aware of the breathing sensation. It's probably the most stable and comforting sensation that we have in the body. Let's bring our awareness to that sense of expansion when we breathe in and grounding when we breathe out. Breathing in, breathing out. And if you'd like to engage with that stable ground, place a hand over your heart chakra just across the sternum. Place another hand across your stomach and observe how the hand rises when you breathe in. Maybe the left hand rises first, maybe the right hand rises first. Practice inhaling into the lower hand and then exhale. Observe how the balloon of the chest just releases. Breathing in, breathing out. And now let's add a little more movement. Rub the palms together and place them over any part of your body that you noticed is a little extra tense. Rub the palms again and place them over top of any other part that feels a little tense. Now see how it would feel if you could roll both your eyeballs to the right. And maybe just a gentle roll from left to right, left to right. Notice how that feels in the body when you do that. And now let's take both eyeballs to one side and let them rest there. maybe looking up slightly. Make sure your head and neck is supported or your stomach is engaged if you're seated. Let's take your few deep breaths. Inhale through the nose and exhale through the nose. Now, I may blink in the middle there, but I encourage you to keep this fairly fixated. You may start to feel a relaxation response through your spine. You may want to yawn or you may want to swallow. Those are all signs that you are shifting your nervous system from trauma response to something calming and restful. Now gently move the eyes to the opposite side, gazing at that corner there. Gently inhale and exhale. Try not to hold your breath. Notice the shift that's happening. You may notice a small sigh or a release where the exhale becomes stronger than the inhale. And then they may equalize, your breathing may equalize. Your sigh or exhale may be a very natural, spontaneous nervous system release. That's when we know that we are tuning down the stress response and we are bringing it all into calmness. Yes, and it's simple. It's really simple, and there is something you can do when you are in chronic pain. Now let's connect with the external world again. What do you notice in your environment? What attracts your attention? You may notice that your mood may shift. You may notice that you're just calmer. You may notice that the colors look brighter and things look a little different than they did just a few minutes ago. This is for you to know how it feels when you're feeling really calm in your body. Gentle inhale and exhale. Now if you like, you can turn this video off and drift off for a nap if that's what's calling for you. It's okay to do that, especially after working like this. It might even be helpful to give your body a little extra rest. Or if you like, you can come up to wakefulness. What I like to do is flick my fingers, rub my palms, place them over the face, and that's what you can do. You can rub your palms, place them behind your head, just giving a little, touch, a comforting touch to the amygdala, which is where the stress response rises. Rub your palms again, place them over any part of your body that still, needs a little comfort. Blink your eyes gently open, and there you are, fully awake. If you like this meditation and if you'd like more information on self-healing, psychological topics, or holistic modes of therapy, please subscribe to this channel and please post in the comments below something that you like, something you'd like to take back with you, or requests, questions, or any feedback that you have is really welcome here. Bye now.